Hello friends, welcome to my channel Breathwell Lung Care because every lung and every breath matters. In a short lecture series, Must Know Classical Science in Thoracic Radiology, I am back with one more very interesting sign which is called as the halo sign. So in today's lecture, I am going to discuss what is halo sign, how it looks like, how to identify halo sign radiologically on CT scan as well as chest X-ray, and what are the conditions in which halo sign is present. So let us start with the today's lecture. So how will you define halo sign? The halo sign is a circular mass or a consolidation which is surrounded by a ground glass opacity. It was first reported by the Kuhlman et al. In 1985 in a case of the pulmonary aspergillosis indicating the hemorrhagic nodule. So there are various diseases which produce the different histological features leading to the formation of the halo. So pathological reason behind the formation of the halo sign is different for the different diseases of the. For example, in case of the invasive aspergillosis, halo represents the hemorrhage, whereas in case of the carcinoma, the halo represents the lipidic spread of the tumor. The appearance of the halo sign on CT scan mostly assessed to be an indication of the pulmonary hemorrhage, but it can also be seen in various infections and inflammatory as well as the neoplastic condition. So let us discuss with these conditions. So it is associated with the fungal infections like invasive aspergillosis, pneumocystic jirovecii pneumonia and candidiasis, bacterial infections like TB, nocardia and legionella, to viral infections like cytomegalovirus and herpes virus, inflammatory conditions like vaginous granulomatosis, vascular causes like infarct, and neoplastic conditions like metastatic tumor, Kaposi sarcoma, bronchoalveolar carcinoma and adenocarcinoma. So these are the very important differential conditions in which the halo signs can be present. So it is very important to rule out all these conditions when the halo sign is present radiologically on CT scan. Although it is a non-specific, the presence of halo sign requires detailed history of the patient and thorough clinical examination or clinical evaluation of that patient and the correlation with the laboratory and radiological investigations to narrow down the differential diagnosis. So all these 3 points are very important, like detailed history, detailed clinical examination and correlation between the laboratory and radiological investigation, which helps in the diagnosis. So let us discuss with one example. This is a CT scan axial view of a 55-year-old male with a 1-month history of the dry cough and diagnosed with the invasive aspergillosis. The CT scan of this patient shows the spiculated nodule, the right middle lobe with a surrounding ground glass opacities, which is shown here with the white arrow, resulting in the radiologic sign which is called as the halo sign. So you can see here there is a one nodule with the spiculated margin. This is a nodule with the spiculated margin surrounded by the ground glass opacity. So this sign is called as the halo sign. This is a one more CT scan of another patient which shows the halo sign with the angio-invasive aspergillosis. So this patient is with the angio-invasive aspergillosis where there is a central area of the consolidation surrounded by the ground glass opacity is present, which is called as the halo sign. This is a one more example or CT scan of a patient which shows the halo sign showing the subpleural pulmonary nodule which is present here. This is the subpleural pulmonary nodule at the posterior segment of right lower lobe which is surrounded by the ground glass opacity. So this is a one more example of the halo sign. This is very important to identify the halo sign radiologically and to differentiate the differential diagnosis one by one by doing the investigation. So I hope you all understand what is halo sign and how it looks like, and you will be able to identify the halo sign on CT scan, and this will definitely help in the diagnosis. So please like and share to this video, and please subscribe to my channel, and please press the bell icon so that you will get the notification of the upcoming videos. Thank you so much.